Hello, my name is Michael McLennan, and welcome to COVID Matters, the podcast produced by COVID-Aid. In each episode, we speak to experts, including those with lived experience, about the key issues facing those affected by the pandemic. For this episode, we spoke to Dr Emily Harrop about how people around the UK have been experiencing bereavement and end-of-life care during the COVID-19 pandemic. Emily is a Marie Curie Research Fellow at Cardiff University. She is a qualitative palliative care researcher with a background in the social sciences. Her research interests are bereavement care and experiences, the support needs of family carers, patient and family experiences of living with advanced illnesses, patient experiences in clinical trials and service innovation and evaluation of palliative and end-of-life care. She is currently Co-Principal Investigator on the Bereavement During COVID-19 study. I hope you appreciate our conversation. I'll be back after the interview. Thank you so much for joining us. It'd be great to start by finding out a bit more about yourself and what you've been up to.
I'm a research fellow at the Marie Curie Research Fellow at Cardiff University, which is a palliative care research centre looking into all aspects of palliative and end-of-life care research. I have a background in social sciences. I did a PhD in sociology, medical sociology. But following that, have been working in palliative care at the centre for the last 10 or so years. And I'd say over the last 4 or 5 years, a lot of my work has been sort of focused around bereavement and support for the relatives of people who died from terminal illnesses. And then with COVID particularly, obviously I've been doing a lot more work around bereavement and bereavement more generally. So not just in the context of palliative care and terminal illness, but all types of death and bereavement.
Can you tell us a bit about how your work changed after lockdown and how that's been?
So yeah, we still haven't been back to the office. We were sent home in March 2020, about a week before the national lockdown began, and have been working remotely ever since with the interest that I had around bereavement when it became apparent that COVID was so sadly causing so many deaths and bereavements. There became a lot of more interest in this work. And so, I have been really busy since going into lockdown. One of the first things that we did was a literature review to see what we could learn from, not just from previous pandemics, but also from other mass bereavement events, looking at, how governments had responded to previous mass bereavement events and maybe if there are any lessons learned from that in terms of supporting people. So there wasn't a huge amount of literature there when we did our searches, but the events that did come up, there was some stuff around September the 11th and, how the New York authorities responded and the interventions they put into place following Hurricane Katrina and also following the Norway terror attacks. So that was one of the first pieces of work really that we did, was just to look to see because obviously there's nothing on previous pandemics actually, obviously there hasn't been anything like this. But we were interested to see if we could learn anything from other sort of mass bereavement events and how governments have responded to it. So that was the first piece of work that I did when we went into lockdown. And then following that, with my colleague Lucy Salmon at the University of Bristol, who I did this review with, we decided to put in a grant application to do some primary research of people's experiences of being bereaved during COVID. And also how the bereavement sector had responded and how they were managing as well, because obviously this was a complete shock to them in terms of not just the greater numbers of people potentially needing support, but also the fact that they were also then having to operate remotely and no longer be giving face-to-face support. So we put in a funding application for that study and were lucky enough to get it funded by the UKRI and the ESRC as part of their kind of rapid COVID response, began that study last August, so August 2020. That was the start of it. And
it'll be great to find out more about that, but I was interested in terms of the initial look at other things such as September the 11th. What were the findings and what were the recommendations at that time?
Obviously, a challenge was that all of these events are very different in their own way, but what we were able to, and the way in which they'd been evaluated and looked at was different and of varying quality in terms of the research. But what we were able to do was identify some sort of key features that cut across some of these different disasters and the responses to them. So, for example, we found that one thing that was done well and was clearly quite important was having a very sort of proactive outreach approach to identifying people who had been bereaved and sort of advertising the support that was available for them. It wasn't enough just to expect people to go looking for the support. There were actually sort of targeted efforts, through sort of mass media campaigns, following 911, through sort of social network approaches, and through other local networks as well, to actually kind of making it, getting the message out to people that there was support being offered. So following September 11th, there was the Project Liberty counselling services that were set up in New York. And that wasn't just for people who'd lost relatives during the disaster. It was also other people who'd suffered other kinds of traumas, like all of the emergency workers and, all the various, there's a lot of trauma in New York at that time. So it was this really rapid response that was, I think it was set up within a few weeks of the disaster, this kind of sort of free, counselling service that could be accessed by anyone affected within the affected area. And, they put on, like radio adverts for it and television adverts for it. So it was really well promoted, and they had quite good uptake across all of the different areas of New York. So that's one thing, having this kind of proactive approach. Another feature that we identified was the importance of having a sort of central kind of organisation, but then using local networks and local, providing the support locally as well. So it was having that kind of coordinated response, but also using the support that was already available in local areas and making the most of that. And another thing that came out was, the importance of the people providing the support, sort of really understanding the context and being able to acknowledge and respond to the context. So, recognising, how the specific aspects of the crisis or the disaster and how that was likely to affect the people in their grief. So kind of went above and beyond a bit, what would be sort of normal bereavement counselling. Although the disasters were quite different, the ones we looked at, we looked at Hurricane Katrina, 911 in Sweden. There was a support for people who lost family members following the tsunami in 2004. So again, it's really different events, but there were these common strands running through the responses to them.
Yeah, and in terms of the primary research that you went on to do, one thing I'm interested in is how you managed to research into such a variety of experiences and the kind of methods that you used for that.
The main way in which we did it was through an online survey for bereaved people. So we set up this survey using our kind of university software, and then promoted it largely through social media to start with, really, through Twitter, through Facebook groups, and which, that was probably the most effective way that we were able to disseminate the survey. It, got shared very widely and in between sort of groups, like the COVID families group, it got shared on their sort of Facebook groups, and also through bereavement organisations. We had really good support from people like Cruz, from Marie Curie, from Sue Ryder. So a lot of the bereavement charities and organisations also then promoted the survey on their social media and their web pages, and in some cases passed it on to service users or clients if they were supporting them. So that they were the sort of two main ways that we were able to reach people who have been affected. But and then also through it got some media interest and attention, so through radio interviews and things like that. So that was our main way of approaching people, was through this kind of online survey.
And in terms of the findings, there's some really kind of shocking or eye-opening stats there, including the fact that I think it was 51% were not provided with information about bereavement support. So I was wondering if you could tell me a bit more about some of those findings and how people felt supported or otherwise. Yeah, so the survey that we carried out had kind of two main parts to it, really. The first part was looking at people's experience at the end of life, sort of in the run-up to death or immediately following the death. And then the second part was looking at their experiences of, bereavement support, accessing bereavement support, so kind of a bit sort of further down the line. Yeah, and we found some really interesting results relating to both of those things. The statistic you mentioned about people not being provided with bereavement support, was quite striking, really. That seems, a really missed opportunity there in terms of, getting the information out to people so that they are then able to get the support that they need. We also found that, people, didn't, I think it was 35% of people didn't feel
kind of well supported by healthcare professionals following the death, which obviously ties into the support they get after the death as well. Other sort of issues really around the end of life, lots of people weren't able to be with their loved ones when they died and will be able to say goodbye to their loved ones, which is, really unusual event in ordinary times, and but something which sadly is, all too common during the pandemic, especially during the first months of the pandemic, when there were sort of blanket bans on being in hospitals, especially on the COVID wards. So yeah, those were some really striking and quite sort of upsetting findings that came out of our first round of survey data. I think we had 64% of people said they hadn't been able to say goodbye as they would have liked. And then also all the issues around not having the sort of contact support from people following the death as well. That was another thing that really came out quite strongly from our results. That people felt very isolated and lonely and weren't able to get the emotional support that they needed during that time.
What do you think were the things that could have been put in place that would have helped people at that sort of time? And I can ask that both for the end of life and then also for the bereavement process as well.
Yeah. I mean, it's really difficult to answer that because it's such exceptional times, isn't it? And it was such a quick thing that seemed to happen with, not really much preparation. So, obviously when we went into lockdown, there was, this almost blanket ban on, family visiting, families being in hospitals for good reason. I mean, they had to control the spread of the infection. But I think what's really also come out of this study is actually just how important, the really long-lasting effects it has on family members and the trauma caused to them by not being able just to be there to comfort their loved one, to have that contact with them, or even some kind of communication. Some of the feedback we're getting back was actually even just, actually FaceTime calls were, they're better than nothing. So I think it was something that got better as the pandemic went on, as they were able to find ways of family members being able to visit if it was felt to be very close to the end, and if there was enough PPE available for family members to wear, and people got better at using iPads and iPhones and establishing more remote forms of contact between patients. I mean, although it's an awful situation, isn't it, that people weren't able to visit as they would normally have been. It's tricky really to know how best to remedy that, other than just to make sure that there are alternative methods available if face-to-face visiting isn't possible. And
in terms of with people who passed away during this time, was there a difference in terms of when people were passing away as a result of COVID-19 or through other kind of means?
Yeah, we did find that there were differences. People whose loved ones died of COVID were sort of less likely to have been able to visit them at the end of life or say goodbye as they would have liked, for I suppose reasons, like I've just said, in the hospitals and especially on the COVID wards, that it was much harder to facilitate visiting and contacts and communication. But we also found that the relatives of people who died of COVID also experienced significantly more sort of social isolation after the death as well, which was something that initially was a bit of surprise. But then I suppose, what you also have to remember is that with the COVID deaths, people who had that contact then also had to isolate, and then there were also further restrictions placed on them. So they were being, sort of further isolated even after their family member had died if they'd had that contact. And then there probably were other sort of factors like greater anxiety around the disease. So maybe that would have made them feel more isolated as well, more reluctant to go out, more reluctant to socialise if from having already had that trauma. So we did find overall experiences were slightly worse when we looked at these factors for people who lost relatives to COVID. But I think what's really important is that actually they affected everyone as well, and everyone who lost loved ones at the time has had an awful time. It's been such a difficult time to be bereaved. So although they were they were only slightly worse for people whose loved ones died of COVID, but they were, they did come out when we did our statistical analysis, they were significantly worse for quite a number of these factors. It's been a terrible time for everyone, so we don't really want to kind of try and make out that it's been better for some groups than others, when really I think the overriding messages is that it's just been such a tough time for people who have lost family members during the pandemic.
And I was interested in the bereavement services as well. And I think one of the things from previous conversations that I've had are around how some frontline workers who aren't necessarily NHS staff, so there's not been a clap for the carers. And so it's not to say, again, like you were saying with bereavement, it's not to say it's been easier for one group than the other, but it does feel like some types of frontline workers haven't potentially received as much support. So I was wondering what your findings were around the bereavement services side.
Yeah, that's something that we've looked at for the voluntary sector bereavement services, which was led by my colleague Lucy. They've run a survey of third sector organisations like the bereavement charities, Cruise, Marie Curie, Survivor. So all of the voluntary sector rather than the statutory sector. And I think it has found that the services have been really stretched at this time. They've experienced funding issues as well as also challenges caused by having to move to remote working and having to really adapt their working practices. We haven't properly analysed those results yet though, so I can't. Sure. I think we do have some data there around impacts on the staff, but I'm not too sure what they are yet.
And how has the nature of your work changed over the course of the pandemic, and where are you now? And I was wondering also how that reflects in terms of the changing times that we live in.
I've not really thought about that before. I mean, still working remotely has been the main one. It's been over a year and we're still working from home. I think we should be starting to go back soon. I suppose, I think when we started the study, I think we thought that by now, we would be properly out of it by the time we'd finished. And when we were doing our follow-up survey rounds, the survey results that we've been reporting on have been the first round survey. We've also sent surveys out at around 7 months post-death for participants. So we timed it to go out around 7 months after their family member died, and then again at 13 months. So we're still carrying out data collection. We're still completing the project. It's strange because you're having to also take into account the changing context. And even in the survey response, some of the people that were filling it in, or their loved ones had died during full lockdown. Others had experienced, the death during sort of periods where we sort of opened up again. So we've also had to try and take that into account when we've been looking at the results and the analysis as well, and just sort of the fact that we're just living in this constantly changing situation. Or even things like doing presentations. If we do a presentation, I constantly have to look to see, and we want to give some background information, whether it's the death rate or it's normally if you present research results, you can kind of leave your presentations, but we're kind of you have to change and update them all the time to just make sure you're kind of keeping up to date with the latest developments. Or in your recommendations even, sometimes we make recommendations and we're in lockdown, so it's in a lockdown situation, but then sometimes you look back at them and you're like, well, that's not really so relevant now because we're kind of out of that again. But then we don't know whether we'll go back into that again. So, it's a new experience kind of doing such live, I suppose, research.
I was going to ask in terms of with the following up, I think you said it was at 7 and 13 months. We haven't analysed. We've only just finished the 7-month survey, so that closed in August, and we're starting to analyse that now. So we haven't analysed that data yet. So I can't. We should be getting onto that within the next few months, and then we'll be releasing some new results. But we're still working our way through all of the first round results. So we've had one paper published in Palliative Medicine now. It's about to be published, and then another one that's been made available as a preprint and is hopefully going to be published soon as well. But we've probably got another 2 or 3 key papers that we need to get out from this first round data. So there's so many different aspects to look at. We've got such rich and important data. We were so lucky to get the response. We had 711 people fill the survey in, which is amazing, really. We're so grateful to everyone who took the time to fill in the survey and share their experiences with us. We're just really working to try and, make the most out of that data and, get the really sort of key messages out there as quickly as we can. Yeah, and I was going to ask in terms of the papers.
The first paper that we published was back in June, and that should be available in Palliative Medicine soon, but it's also available as a preprint on the medRxiv server. And that one was looking at largely at access to bereavement support following the death. What types of support people have been accessing, whether, what support they felt they needed. We looked at people's support needs, and whether they had experienced difficulties getting the support that they needed. So we were able to identify quite a few different sort of barriers for people to getting the support. Some were kind of more obvious ones, like just lack of availability, long waiting lists. But there were also issues around people not knowing how to get support, which links back to, to the point we discussed earlier about people not being given information about support. But also, people reported feeling uncomfortable asking for help, especially during a time of crisis. And, that's something that people who had, lost family members to non-COVID illnesses, they said in particular that they felt sort of in some ways less entitled to support, which is obviously really, really sad that people were feeling that way. And then also a lot of issues around people getting the support they needed from friends and family. So it wasn't just that people weren't getting the support that they may have wanted from services, but it was people also felt that they weren't being supported in the way that they needed from friends and family. And again, this was partly, this is due to some things like just feeling uncomfortable talking about it. I think as a society, we're not that great about how we talk about, death and bereavement, and how we, feeling open enough to be able to discuss these issues. But then there were also kind of issues to do with lockdown and just the fact that people couldn't see their friends and family and weren't able to get the kind of face-to-face support and the sort of the physical comfort that they really needed during a bereavement. I think that was something that was really, really hard for people. It's just being cut off from their sort of sources of support at such a difficult time.
In terms of other papers, what are the ones that are kind of upcoming, or are you planning?
Yeah. So the other paper that's just been submitted and is available as a preprint is that one my colleague Lucy wrote, and that one's looking at experiences at the end of life. And that was a quantitative paper, so it was looking at the statistics. So it was some of the issues that we talked about earlier about people not feeling supported after the death, or not feeling involved in the decisions that were made, or problems with communication. And that paper looks at some of the differences between types of death, so COVID and non-COVID, and also where people died, the kind of impact that had on people's experiences at the end of life. And there were some interesting differences there, although not necessarily unexpected. I think people whose family members died in hospices tended to fare a bit better in terms of their experiences of end-of-life care compared to hospitals. And again, that's perhaps not all that surprising in the context of the huge stress that hospitals were under, and the fact that people providing palliative care, that's something that we know that they do quite well, is communicate with family members and provide that sort of more holistic support and approach.
And then in terms of recommendations, I know it'll be hard from the sense of, as you said, things having changed and the variety, but are there any key recommendations that you found from the work that you've been doing so far?
Yeah, so with the sort of key recommendations we've identified are around, in terms of end-of-life stuff, sort of trying to find ways of improving communications with families at the end of life. So although, that can be really difficult in the context of the pandemic and infection control requirements, I think it's important that contact is enabled with patients and family members as much as possible. We can see just how important that is, and the kind of long-term effects that it has on people, not having that contact. A lot of our participants talked about how they felt, had this sort of real lasting sort of guilt and trauma really relating to the fact that they hadn't been able to be there with them. And then sort of moving on, just making sure that as when people are bereaved, that there is the support available for them if they need it. I mean, not everybody needs support from services. Quite a lot of people will get the support they need from friends and family. But I think what our study has shown is that the support available for friends and family has been quite challenging because of the pandemic, and that maybe there is a greater demand at the moment for additional support from services as well. So it's just making sure that there's sufficient resourcing of these services, because we know that they've also been really stretched. And there were some messages around just trying to make sure that the right support is available for people. So we had some feedback around people. It's difficult. A lot of people felt they needed face-to-face support, although some people were very happy with the remote support and telephone support they got. Other people just felt they couldn't, talk about these issues over the phone with someone. They did really need face-to-face support. So again, when that's a possibility, it's important that face-to-face options are available. And also people felt that, especially in the early days, that there needed to be more recognition of what it was to lose somebody during the pandemic. So that maybe counsellors providing the support, they needed to be able to sort of recognise, sort of the added sort of strains and stresses and the sort of specific nature of losing somebody to COVID or during COVID, and having that kind of, those sort of competencies around pandemic bereavement. And then the other key message actually was around just raising awareness of the support that is available, because that was something that, we found is that quite a lot of people just didn't know what support was available or how to get the support. There just isn't enough information out there on how people can access support if they feel that they need it. But I talked about the review we did at the start and how a really important aspect of those responses was around kind of this proactive outreach approach and advertising of services. And I think, you can see that is something that probably would have really helped in this context, is just there being better information on the support that is available for people.
As a bigger question, I was wondering whether you thought that we, as a nation, have quite dealt with the scale of loss that's been experienced. So it was interesting when you were saying there about the fact that some people there's been kind of more of isolation, loneliness around the experience that they've had. And I wonder if you think that ties into a wider fact that we've not maybe had a moment to reflect.
Yeah, I think probably that it is the case, that it's just been this kind of bit of a whirlwind sort of 18 months for everybody, really. And I mean, particularly people who have lost family members, or experienced other kinds of trauma because of the pandemic. But I think, as a society, it's been difficult to kind of stop and take stock when it's still been going on. And I think, that's something that really has sort of sets us apart from, some of the other mass bereavement disasters that I talked about earlier, is the fact that they were discrete events. They happened, and then the recovery phase began immediately, and you could see that, the responses began immediately, the interventions were introduced. Whereas with COVID, that's not really been possible, because it's just continuing, isn't it? So it's actually been very difficult for everyone, I think, to kind of stop and start to pick up the pieces when it's something that's still going on. I think, having that opportunity, like back in March, there was the National Day of Reflection, and I think having those opportunities are really important. And I think that was an important event for people to be able to just stop and take a minute, even whether you've lost somebody personally or not, just to sort of think about as a society, the scale of the trauma and the loss. I think that's something, that is important. I think that's particularly important to people who have been bereaved. And that's some in the comments that we had in our survey, that was something that came out, was just feeling kind of that their deaths have been a statistic, and that it had been quite dehumanising, the way it had been reported in the media and all of the constant coverage of the death rates and the statistics, and but actually for the people who'd experienced those loss, that actually had quite a sort of significant effect on them as well, and just feeling a bit forgotten about. So having those opportunities to sort of remember are very important, I think.
As a final question, I was just wondering personally, what are your own hopes going forward in terms of the work that you're doing?
If you try to see the positives, I think one thing that's come out of this is this greater interest really in bereavement, and how people who are bereaved could be better supported, not just from services, but also just informally through sort of informal networks, through friends, family, and through sort of community organisations, and just trying to sort of generally have a better appreciation of the needs of people who are bereaved and how they can be addressed. So it's not just through I think it's really important that if people feel they need counselling and therapeutic support, that they're able to access that. But it's also having opportunities just for greater kind of sort of social contact with other people, and sort of initiatives that kind of help to address some loneliness and social isolation. I think that's really been brought to the fore from the pandemic as well. So I think just having greater attention on that at the moment is something that could hopefully improve things for the better as we start to come out of the pandemic. At the moment, some of the main bereavement charities have set up a commission on bereavement. I don't know if you've heard about that. It's the UK Bereavement Commission. There's a call out for evidence at the moment, so we'll be feeding in our research findings to that. Other people will be receiving research findings, but then there's also an opportunity for people and members of the public to contribute to that and answer the questions in the call to evidence, as well as lots of different organisations. And then the Commission will be making a report and some recommendations. And hopefully, with the weight of the Commission, there's been a lot of engagement with policymakers across the UK that we might start to see sort of positive changes in terms of the support that's available for bereaved people. So, yeah, the more positive side is that it has brought, I think, something that's been not quite right for a long time, and I think there have been real gaps in bereavement support and the needs of bereaved people, before the pandemic. I think they became a lot worse because of the pandemic, but now I think there's, because of that, there is more interest and hopefully a greater commitment to trying to make sure that the support that people need is going to be more forthcoming as we sort of go forward.
Yeah, I definitely hope that's the case too. So thank you very much for your time.
Okay, thank you.
Thanks so much to Emily for her time. If you haven't heard of us, COVID-Aid is the UK's national charity dedicated to supporting all those significantly affected by the COVID-19 pandemic. We want to help anyone who is struggling but may not have found the correct resources or support system to help. By building an empowering and caring community, we provide a safe space where people's voices can be heard and where you can gain access to support specific to your needs. We'd love to have you as part of our community, so please visit covidaidcharity.org. That is covidaidcharity.org, and you can also find us on social media. We'll be back soon with another episode, and until then, please take care.